Comparison of field of view optimized and constrained undistorted single-shot diffusion-weighted imaging and conventional diffusion-weighted imaging of optic nerve and chiasma at 3T. Via Neuroradiology. Abstract. Purpose. Single-shot echo-planar imaging is the conventional diffusion-weighted imaging, C-DWI, sequence for evaluating orbital disease. However, its utility is restricted in small organs like the chiasma and optic nerve. This study was conducted to investigate the utility of field of view optimized and constrained undistorted single-shot diffusion-weighted imaging, FOCUS-DWI, for evaluating the chiasma and optic nerve in acute optic neuritis, making comparisons with C-DWI. Methods. FOCUS-DWI and C-DWI were performed on 36 acute optic neuritis patients and 16 normal controls. 2 readers assessed image quality using 5-point Likert scales. Differences in the visual assessments and apparent diffusion coefficient, ADC, values between C-DWI and FOCUS-DWI were evaluated. Inter-observer agreement in the qualitative data was assessed using Cohen's kappa coefficients. Inter- and intra-observer agreements in the ADC values were evaluated using interclass correlation coefficients. Results. FOCUS-DWI was superior to C-DWI in all aspects of the image evaluations. The Cohen's kappa coefficients for FOCUS-DWI were almost perfect, 0.81 to 1, or substantial, 0.61 to 0.80, for all the image quality categories. In the FOCUS-DWI images, the structural conspicuity of the chiasma and canalicular and cisternal segments was significantly superior on coronal views than on axial views, p0.0001. ROC analysis showed that in optic neuritis patients, the diagnostic value of ADC measurements on FOCUS-DWI was higher than ADC values measured on C-DWI. Conclusion. The FOCUS-DWI technique can provide substantial improvements over C-DWI for imaging different aspects of the optic nerve and chiasma. The coronal scan direction is more suitable than the axial scan direction for FOCUS-DWI. Add tags, currently, Imaging, Neurology, Medicine by Alexandros G. Sfakianakis.